Hello, I'm Chris Good, and I'm a spine surgeon at the Virginia Spine Institute. I'm going to try and help you to understand a little bit about how the neck works and the common cause of some of the problems that people get with their necks or their cervical spine. So the cervical spine starts at the base of the head and goes down to the shoulders. And that portion of the neck is extremely mobile, meaning we have all kinds of ability to move through our neck. Now, the spine is a series of bones and discs that are stacked one on top of another, and they all join together like cars on a roller coaster. And so as we move, we are moving across our discs and our joints as we live through our lives. Now, for some people, they will start to get troubles from overuse. Now, how healthy our discs are depends a little bit on good luck, but also depends a lot on the genetics we get from our family and wear and tear throughout the years. And so for most of us, how our spines are doing is really dependent on all these factors together. Unfortunately, some of those things we have control over, some of them we really don't. Now, I'm going to show you a model to explain things a little bit further. So here we see a front view of the spine, and we can see the spine has bones and little discs that are stacked one on top of another. And in this model, there's no muscles, but we can see the spine has the ability to flex and extend and rotate. Now, the discs and the bones are in the front part of the spine, so they're just underneath your breathing tube here. In fact, I'm touching my discs. The back part of the spine, there are these bones that stick out, and those are the bones you feel in the back of your neck, called the spinous processes. The brain, which sits inside our head, turns into the spinal cord, which runs down inside the spine, just like a cable inside a conduit pipe. And the spinal cord, which is extremely important structure, runs inside the spine, and little nerves branch off the spinal cord at each level, and then the neck. Those nerves come out of the neck, through our shoulder, and then they run down our arms. And those nerves give us the ability to function. They control our muscles, they control our ability to feel things. Okay. Now, for many people, as time goes on, the discs in our spine will start to age or degenerate. The process of degeneration starts with a normal, healthy, spongy or elastic disc. Over time, that disc may start to dry up a little bit. It may start to crack and tear and degenerate. If you think of an old rubber band sitting out on the desk over the years, initially it's very stretchy. And then later on you pick it up and it still stretches, but you can see it's getting a little old, some cracks. And one day you might pick that rubber band up and the thing just disintegrates in your hands. Well, that is a similar process to what's happening in our discs. Now, this disc degeneration is a normal part of life, and essentially everybody has it if they live long enough. But for some people, the disc degeneration will lead to problems, will lead to symptoms. Now, one common symptom that we see is if someone has a disc that's degenerating, it will cause them pain. And while the disc is located here, the patient doesn't usually feel pain here. They usually feel pain back behind their shoulder blades. And that's something that's a little hard to understand, but it has to do with the way the brain is wired and the concept of referred pain, meaning a problem here can actually be felt by the brain in another area of the body. Now, people who have these kind of pains in the neck, we see all the time. Now, sometimes they just come and go quickly and they're not much to worry about, but some people will have more significant degeneration that will lead to chronic problems and go on to other forms of treatment. Another common thing that we'll see is if someone develops a herniation or a tear in one of the discs or grows a bone spur that compresses up against the nerves or the spinal cord. And so in that situation, it's not really just a neck pain. It typically will involve some type of neurologic symptom. So if people get a pinched nerve in the neck, that will commonly cause neck pain, but also cause some kind of pain or numbness to radiate down the arm. And whichever nerve is pinched dictates where the pain is felt. Now, pinched nerves can lead to pain, numbness, and weakness. Now, luckily, most people, if they get a disc herniation and a pinched nerve, over time the body does have the ability to heal. So through high-level physical therapy and non-operative treatments, we're able to get many people better. But some people will get nerve damage as a result of this and even go on to consider a surgical procedure. Now, when I see people who are having neck pain, we all think of it, oh, maybe it's just muscular and just muscular. And certainly, muscular pain is an important consideration. But it's also important to know that damage to the deep structures of the neck can trigger muscular pain. So in many cases, the muscular pain or the muscle spasm is really kind of secondary to some other problem. Now, if people start to get compression of the spinal cord, that's the important cable right in the middle. That's probably the most concerning thing that can happen. The spinal cord in the neck controls everything in our entire bodies in terms of function. And so people with spinal cord compression can start to develop neurologic problems, troubles with their coordination or weakness. It can even lead to people having the ability to walk. People start to drop things. And if you're having those type of neurologic symptoms, that's the kind of thing that you really want to get checked out by your doctor right away. Spinal cord compression in the neck can be dangerous in some situations. Now, most people with the right kind of physical therapy, high-level spinal manipulation, we're able to get them back feeling good. And most of us can live a good life even if we do have some disc degeneration or some arthritis in our neck. If someone gets a situation where they're having worsening nerve damage or pinching or compression of the spinal cord, that can be a situation where we need to go beyond things like physical therapy or injections and consider a surgical procedure. Now, when we think about surgery for a neck problem, the most important consideration is figuring out what the primary problem is. Now, for many people, because disc disease has a genetic component, it may be that multiple discs in the neck are starting to wear. Think about getting gray hair. Most people don't just get one. They get gray hair in multiple areas. And if you get gray hair in one area, plucking that one out isn't going to keep you from getting gray hair in another area. So if we see someone who has the situation developing at multiple discs in the neck, we have to be careful to try and understand which disc is causing the problems and which treatment has the highest chance of helping for people. Now, if people have a disc problem that needs surgery, the most common approach that we would use would be called an anterior cervical surgery. That means front of the neck. And that's a surgery where an incision is made in the front of the neck, and the surgeon goes just to the side of the voice box and the swallowing tube, your trachea and your esophagus, and can approach the spine through a minimally invasive approach, right to get to the disc. Now, when I do this, I use a microscope to magnify things, and I'm able to go in and let's say I need to remove a disc or to unpinch a nerve. I do that from an anterior cervical approach. Now, when we do that, that leaves a disc that's been removed, and something needs to be done in its place. And there are two basic options that can be done. The first would be called an anterior cervical fusion. The other would be a disc replacement. So a fusion is a process where implants are placed to fuse or weld the bones together. And so this is a model that has just a plate that sits on the front of one of the discs. It's meant to signify a fusion. And so a disc can be removed and a bone graft or a cage placed with a plate on the front to weld the bones together. Now, for the right patient, this is a phenomenally successful surgery, and this really is the most common method we use to take care of neck problems. Now, the downside of a fusion is that it does eliminate the motion of that one particular disc. Now, if someone needs to have one disc fused, they have all their other discs working well, they typically don't notice much in terms of losing motion. But if people require more levels of the neck fused, that can be a bigger deal in terms of decreasing the amount of motion a patient has left over. That is one of the reasons that we're very excited about the possibility of using disc replacement as an alternative to fusion in many situations. And so a disc replacement, we remove the disc, but instead of putting in a cage and a bone graft, we actually insert a device that moves. And there are different devices available, but this is a model, and we can see this particular one has almost like a ball and a socket shape. And when that is implanted, it preserves the ability of the spine to flex and extend and rotate. And so that does not include a fusion and can be a better option for some people down the road. In fact, some of our studies are showing that people who end up having a disc replacement go longer before they develop an issue at one of the other discs down the road. The thought being that a fusion that causes stiffness at one disc may put additional stress on the other discs, cause them to work overtime and wear out faster. Now, in terms of deciding between a disc replacement or a fusion, there are a lot of important factors, and a disc replacement is not the right option every single time. So we have to figure out, is a disc replacement a predictable or good option, but it is really nice to be able to preserve motion for people who have a problem that is amenable to that treatment. We're also doing a lot of exciting work for people who may need more than one disc to have surgery. Let's say there's one disc that requires a fusion for some structural reason, but the disc next to it might be able to get a disc replacement. That's a situation where we may be able to preserve some of the motion of the neck and also be able to protect some of the other discs down the road better than if we had to fuse multiple levels in a row. And so whenever we're considering surgery, we have to choose the right levels, we have to choose the right surgery, and then we have to determine if a motion preservation, like a disc replacement, is a good option for a patient, or if a fusion has the better long-term chances for them. Now, there's another type of surgery that can be done, instead of going in the front of the neck, going in the back of the neck. This is called a posterior cervical procedure. So instead of going in the front here, it's through the back. That's a surgery where surgeons go in and they're able to do microsurgery to shave a little space around a pinched nerve, or to go in and place implants to fuse or weld the bones together. The majority of the neck surgery that I'm recommending is typically done through the front. In general, that is a less painful operation and easier recovery for most people. But there are certain times when people have many levels of the spine that need to be addressed, or other situations where a surgery in the back of the spine may be best. That surgery is typically more painful afterward because the cut causes more muscle spasm. And so the recovery, we need to be prepared for a more challenging recovery in that situation. It's all about trying to line up which surgery we choose based on what problem the patient has. So it's not always up to us which surgery we want to do. We really have to figure out which one addresses the patient's problem the best to get them feeling better in the long run.